The following videos present predominantly my experience with narrowband imaging. This is a flexible cystoscopy actually done by Dr. Jean de la Rosette. And you can see as he enters the previous TURP channel, he utilizes a flexion of the scope and a rotation of the wrist to visualize the bladder. It is important to have a system, and the system is described on the left. And here you see as he does the retrovert to review the bladder neck, which is an advantage of the flexible cystoscopy, he turns on the NBI. And you can toggle the NBI and white light intermittently to characterize a lesion. Here he sees another red lesion, and toggling in between NBI and white light, he can better characterize the lesion. This area looks suspiciously like a area of CIS, and he toggles in between the white light here. He pulls back, and even with NBI, you can look at the prostatic channel. And this is a patient who has had a TURP before. The important thing about using flexible cystoscopy with enhanced imaging is that you need to hold a camera steady. When you toggle the NBI, there is a light reduction, and it obviously looks dimmer, and you will need to hold steady at a shorter distance to the lesion. In this case, he's looking at one of the urethric orifice, and as he moves, and the movement of the flexible cystoscopy predominantly with a rotation of the wrist and up and down flexion of the thumb. This is the other urethric orifice, and you can see if the movement is very quick, then enhanced imaging may not facilitate the vision. It's a great idea to show these videos because from still pictures you can characterize it very clearly, but in real life the movement of the scopes is not static, and it is important to train in the visualization on a continuous movement. Here you see a retroversion, another important feature of the flexible scope over rigid scope. I tend to do an NBI also before a TURBT using a rigid cystoscopy. Again, a careful mapping of the whole bladder with the cystoscope is important. And here you see my resident going from side to side to carefully characterize the entire bladder from bottom to top, where you see the air bubbles in the dome. And this is from left to right, from UO to UO, bladder neck to bladder neck. It is important to cover the bladder carefully, whether you do it with a flexible or rigid. And I tend to then do the NBI after I've done a rigid cystoscopy if I do not find any major lesions, but tend to toggle in between if needed. And again, with the NBI, you will try to be systematic for the second examination of the bladder. Let's look at some lesions, and this is a classic low-grade papillary pedunculated lesion, and you can see that it is close associated in the UO. You turn on the NBI and you see the obvious blood vessels in the pedunculated lesion here. Of note, bleeding or blood clots in the bladder can impair the NBI visualization because the blood clot will also be enhanced and darkened. This can be flushed, but of course, if you were to look at these lesions, then you need to do it before you do any bladder biopsy. Here we see an area which we thought was suspicious in the same patient, but with NBI, it shows that this is an area of increased vascularization and probably not a serious area. If you're concerned, you can biopsy. And the palm lump is a very interesting lesion that we can see here, and you can almost identify very clearly with the NBI. And you can see there's hardly any vascularity in this papillary pedunculated lesion. NBI, I feel, helps to mark out resection margins clearly. And here with white light, you are going around and to assess how you're going to resect this lesion. And this is a great lesion to be doing en bloc resection. And from the underside, where my arrow was pointing, you may or may not have seen the close association with the urethric orifice and obvious tumor under NBI lighting. So with the NBI enhanced visualization, we would therefore be able to be more confident to mark out the resection margins to include the urethric orifice. There is no, we can't spare the urethric orifice in this case. And the NBI enables us to be more confident in identifying resection margin that has to include the UO. And here we did another deeper bite for the urethric orifice to get the deep margin after en bloc resection. What are the limitations? Now this is obvious in a patient with presenting with gross hematuria. We are going in there to do a cystodiatomy, stop the bleeding, obviously needing to do a TURBT. You see multiple extensive nodular tumor, evidence of bleeding. The tumor looks obviously high grade. And here you find that with the blood clot, multiple nodules, the NBI probably and any other enhanced imaging will provide very limited other information beyond telling you that these are all tumors. But probably in patients with ongoing gross hematuria, enhanced imaging, NBI, or blue light cystoscopy may not provide additional information. What I think is exciting is the use of NBI as enhanced imaging in the upper tract ureteroscopy or flexible ureteroscopy to examine the urinary collecting system. And here we have examination using a flexible nephroscope of the renal pelvis and collecting system before I try to do a nephron sparing surgery, a subtotal uretrectomy of the solitary kidney. You see a lesion in the pelvis, which I was not sure whether it was in association with inflammation with the PCN, percutaneous nephrostomy, but on NBI, it clearly shows it is likely to be a neoplasm. We therefore are able to biopsy and laser this and other lesions before we join the ileal conduit directly to the renal pelvis to try and save this solitary kidney. And we know that the kidney lesion is low grade. This slide again shows the use of narrowband imaging in flexible ureteroscopy to tumor ablate before tumor ablation in this kidney. And this is likely a low-grade lesion that was identified on CT urogram, and the flexible ureteroscopy identifies this. On white light, you have to say that the margins of the lesion are not so clearly visualized. But with NBI, the three-dimensional visualization, the clearer visualization of the vessels through the cancer, you can clearly see the area or the region of the lesion that you want to mark out and ablate. That's all the videos I have in this topic. Thank you very much.